Hello and welcome back. So we are on to the next section of chapter 14, which is the nature of infectious disease. And so there's a couple definitions I want to talk about from the notes here before we jump into the slides. First of all, what is disease? So just the definition from the book, it says when an injury from a parasite is significant enough to interfere with the normal functioning of the body. So that's the state of disease. And then we have morbidity is any change away from the state of health. So a lot of you, if you've taken your anatomy physiology, you know the term homeostasis. So when an infection, a parasite, pathogen, whatever you want to call it, takes you away from homeostasis, normal, state of health, then we can call that a disease. And we also use the term morbidity, which is a state of health, state of non-health, state of non-homeostasis, if you will. So what are you looking for these states of non-health, this taking you out of homeostasis? Well, a lot of times you might hear the words, a sign or a symptom. What are the symptoms? What are the signs? And they're actually not interchangeable. They do mean different things. So this is a table just from your textbook to give examples of the differences between symptoms and signs. So a symptom is more of what is felt by the patient. They're not outward measurable or detectable experiences. So pain. There's pain scales, sure, but everybody feels pain a little bit differently. So it's like subjective. These are subjective things. I'm tired, I'm cold, I have a headache, my throat is sore, I got stomach aches, it's painful. Those would be considered symptoms. Signs, on the other hand, are things that can be directly observed or measured by somebody else. So if you got an infected, cut, people other than you can see it's red, it's swollen, there's a rash, you're vomiting, your blood work comes back, you have a high heart rate, a low heart rate, you have swollen lymph nodes. All of those things are signs that can be observed. So when we talk about disease, when you're looking up like for your case studies in those chapters at the end of the book, each disease usually has a selection of signs and symptoms. So for particular diseases, they cause your body to react in particular ways. So that's, trying to incorporate some of what we're going through now globally is what are the signs and symptoms of COVID-19? Well, at first, what were we being told? A cough, shortness of breath, and a fever. And those were kind of the most common ones, and they still are. But as more and more people got exposed to this virus and more information was being shared, there was a lot of other signs and symptoms that were showing up, diarrhea and vomiting and severe fatigue and loss of smell and loss of taste, and weird rashes and blood clots and all of these other things that are showing up that would, we're trying to coalesce all of these observations into how do we know somebody has this particular disease. All right, so now we're going to move on into kind of something that we've already seen before with Koch's postulates. There's a term in here called etiology, which is the study of the cause of disease, which I guess you could think of Koch as being kind of the forefather of that. So if you remember, Koch's postulates were a way for him to identify and kind of propose a germ theory of disease. Because remember, before our understanding of microbes and we had microscopes to see these things, disease was attributed to lots of things that aren't real, right? So like bad air or inheritance or curses or things like that, kind of mystical, magical things. So Koch's postulates with his experiments with anthrax came out to say, okay, so once we can check all of these boxes, the suspected germ must be present in every case of the disease and absent from the healthy host. We have to grow and isolate that particular pathogen outside of the host. That was our step 2. Step 3, we're going to inject that isolated pathogen into a susceptible host. Step 4, the host is going to get the same illness and we re-isolate that organism out of that host. So all of those have to be check marked to say, yes, this is the pathogen that causes this particular disease. And for the most part, that supports things. However, there's some exceptions to that, right? So what if the disease only infects humans? Who's going to volunteer to be that susceptible host? Clearly, we cannot do human inoculations of a suspected pathogen to make sure that that is the pathogen that causes the disease, right? We can't do that. Sometimes There's exceptions to step 2, where there are some organisms that just do not grow outside of the human body. I want to say syphilis is one of those, that it just doesn't grow in the lab. So how can you fulfill that one of Koch's postulates? And then sometimes there's some diseases that are caused by multiple organisms or the interactions of multiple organisms, and you can't narrow it down to just one particular pathogen. So even as good as they are, there are always going to be some exceptions to these rules that we cannot fulfill all of Koch's postulates to make that connection between each pathogen and the disease that they cause. All right. Okay, I think I hit on those. All right, so now when we're talking about this state of disease, the signs and symptoms, how diseases are connected to their pathogen, what do these pathogens do in our bodies to actually make us sick? So let's take a look. The measurement of how well a pathogen can cause disease is called virulence or virulence. I've heard it pronounced either way. So this is basically, virulence is the degree of pathogenicity or the ability of the pathogen to infect a host. So you might have something that can cause disease, but if it doesn't do it very easily, it's very low virulence. Where something can cause disease and it's very easy to make you sick, that has high virulence. So for example, the most virulent on this particular chart is a bacteria called Francisella tularensis, which causes what we know as rabbit fever. The infectious dose of this particular pathogen is very small, like 10 cells. Now, when we're talking about bacteria, 10 cells is like nothing. Usually you'd have to have thousands and thousands of cells to be in your body before you actually get sick. So the reason why rabbit fever pathogen is high on the virulence list is because it causes disease really easily. Now, it doesn't mean the disease is very bad. Most people are fine, recover from it, or some antibiotics you can do okay. Virulence does not equate to severity. It's just how easy is it for this pathogen to make you sick? And then pathogenicity is just the ability for something to make you sick. So all of these are pathogens. Some of them do it really easily, like rabbit fever, and some of them are a little bit harder. So lactobacillus, they can cause disease, but it's not really easy. You might need a whole lot of them, like a whole lot of these bacteria before they can actually cause sickness. Okay. So for the ability for them to make you sick, we have these things called virulence factors or virulence factors. And if you remember some of the plasmids that bacteria carry on, the factors that are on these plasmids, some of them are virulence factors that give them the ability to cause disease in certain ways. So this first slide of virulence factors is a group of enzymes called extracellular enzymes. So just as the name implies, these are enzymes the bacteria secrete outside of themselves, which affect their environment, which is us, as these are pathogens that have got into our body that allow them to be pathogenic. So the first collection, these ones up here, we have hyaluronidase and collagenase. So hyaluronic acid is part of the intercellular connections. If you've taken A&P, you remember in epithelial tissue, we had like intercellular cement and the gap junctions and tight junctions and all those types of things that held the tissues together. Hyaluronic acid was one of those. So if you have an enzyme called hyaluronidase, you could suspect that it's going to start destroying those intercellular connections. And so now you have a gap that your pathogen can seep down into. And then if you remember, your basement membrane is made up of collagen and your connective tissues underneath are made up of collagen. So if you have collagenase, it's going to start destroying that basement membrane, which are our physical barriers. So for this surface organism that has hyaluronidase and collagenase, they basically dissolve their way into your deeper tissues, which can then start your infection. The next set of extracellular enzymes are called coagulase and kinase. So here you get the bacteria in deeper into your tissues, maybe close to a bloodstream. Coagulase, just like the name implies, actually draws out some of your blood clotting proteins. And like your fibrin and fibrinogen makes this fibrin clot. And now you have the bacteria surrounded by a clot. Do you think that's going to be easy for a macrophage to find or your immune system to find? No, because it's totally now hidden and it can take in this little clot and it can replicate and maybe increase its numbers, produce other enzymes. And then when it's ready to release itself deeper into your tissues, it takes this enzyme called kinase, breaks down the collagen or the clot, breaks down this fibrinogen clot, releasing the bacteria deeper into your tissues or even into your bloodstream. So those are called extracellular enzymes, can be used to make bacteria virulent, allowing them to cause disease. The next one are toxins. Okay, so we had extracellular enzymes, and now we have bacteria that can release toxins. So exotoxins are toxins that are released, obviously, outside of the body. So cytotoxins kill their host cell, so those little red circles would be the toxin. We have other types of exotoxins, like neurotoxins, which are specifically functioning to interrupt neural signals, like botulism toxin and tetanus toxin are neurotoxins. We have enterotoxins, are the ones that affect your digestive tract, that would give you like food poisoning, things like that. And then we have endotoxins. So endotoxins are only found on those gram-negative bacteria. So that lipopolysaccharide layer, that lipid A part of that outer membrane, that is the endotoxin. So in an intact bacteria, it's not a problem. Let's say your phagocytes are doing their job, they engulf some gram-negative bacteria, they break them down, and in breaking down that cell wall, they're releasing the endotoxins into your bloodstream, into your tissues, and that can cause some severe side effects like fever, inflammation, diarrhea, shock, blood coagulation, drops in blood pressure, and those outcomes of the endotoxin can be almost as bad or worse than the original infection. So that's another reason why you want to figure out what your infection is, so the doctors can figure out the best course of action for that. Okay. Some more virulence factors. We had enzymes, toxins, and now we have antiphagocytic factors. Capsules. We talked about capsules and slime layers way back in chapter 3, these glycocalyces. And so they help to prevent being phagocytized. So that's part of your non-specific defenses. Your phagocytes want to go and eat all the things that are foreign. But if it has a capsule, it makes it hard for them to do that. Another mechanism of how pathogens can become pathogenic is they can be engulfed, right? They can be phagocytized, but they have abilities to block this fusion with the lysosome. And then now they're free to replicate inside of the phagosome, inside that little vesicle that they were engulfed in, and then they replicate inside of the cell, hidden by the rest of the immune system. So I want to say listeria. We have a couple of listeria outbreaks recently, like in ice cream and things like that. Listeria, there's a whole spread of it in the disease chapters towards the end of the book in the nervous system. And they do this incomplete phagocytosis where they get engulfed, they block the fusion of the phagosome, the lysosome into the phagosome, they replicate, and then they actually, if they're infected in one macrophage, they reach out through these little like actin tails and then infect the next cell. They don't even leave the cell, and so they're completely hidden from the immune system. It's pretty amazing. So that's a really good virulence factor. All right, so as we're progressing through a discussion of the disease, we've covered how the bacteria or viruses get into us by the portals of entry, the reservoirs where they can come from, how they get in, how they attach to our host cells, a lot of their virulence factors. So now let's say it's set up an infection. We are infected. We're getting sick. What does that look like? Well, we have these stages of infectious disease. So as we're going through this, think about the last time you were sick and see if you can recognize these stages in your progression of your illness. It could have been the cold or a flu or a sinus infection or, whatever illness, infectious disease you were dealing with. So first, let's say, sneeze in your face, or you forgot to wash your hands, or somebody coughed, or you're breathing somebody's respiratory droplets. Hopefully that's not the case because we're all supposed to be socially, physically distant and wearing masks. But still, it's going to happen. Pathogens are out there, not just COVID, but there's all these other pathogens that have been in our world before this showed up on the scene. So we have what's called the incubation period is the first time. It is getting in your body, it's getting used to your body, it's growing, it's replicating, it's getting into, it's maybe a quorum sensing biofilm somewhere, And usually the virulence factors are not turned on at this point. So we call this incubation period, typically no signs or symptoms. And that's going to be different from organism to organism. So we can see there's no unit, this is time. So for some diseases like the common cold, incubation period is like a day or two. For Ebola, if you remember way back when that happened, it could be up to 21 days, so 3 weeks before you could actually start seeing signs and symptoms. I think for COVID, it's what, a couple days, 3-5 days, 2 weeks. I don't know if they've pinpointed that particular number, if it might be a broader range depending on the person. And then we move into prodromal. So it's like, this is for me, when I'm getting sick, it's like, oh, I'm really tired. I had a hard day. You know, I was at the gym, or you just feel a little bit more run down than normal, but you usually attribute it to something else, not that you're getting sick. Just general vague symptoms like a little bit of a sore throat. Maybe I talked too much in class today, or my joints are kind of achy. Maybe I just was on my feet too much. And then the next day you're like, yeah, this is more than just having a hard day. I'm getting sick. So your signs and symptoms are the most severe. So you're really starting to feel the sore throat. You're getting a fever. Your joints are achy. You're feeling really tired. You're getting the runny nose, blah, 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 all the stuff that comes along with being sick. So, and that again is going to last a different amount of time per the illness. So colds last a couple days, flu might last a couple weeks, COVID is all over the board, who knows. And then you're going to peak with your signs and symptoms, and then eventually you're going to get to the decline phase if your body can overwhelm it with its immune system response or external therapeutic treatments, is you're starting to feel a little bit better. So in my household, it's like when I'm feeling really sick, I'm like, oh, I'm at 50%. And as I'm starting to feel better, I'm like, I'm feeling about 80%. And then I feel a little bit, I'm getting close to 90%. And then when I'm all better, convalescence, yay, I'm back to 100% me. And I'm feeling good. And whatever I had, it's gone. It's moved along. So this is your stages of infectious disease: your incubation, prodromal, illness, decline, and convalescence. In the absence of treatment, most of the time our body can go from one point to the other. It is around this stage here, kind of ish, kind of my big circle, is if your body cannot fight off the pathogen and there's no successful treatment, this is where death can occur. There are some diseases where death is likely, like rabies. So if you are infected with rabies and you start to show signs and symptoms, there's almost 100% chance that you're going to die. And that's just the nature of the disease. We're not going to say that for the common cold. Most people don't die from the common cold because it just doesn't produce severe signs and symptoms. Your immune system can take care of it. You really don't even need any treatment. In bacterial infections, sometimes you can get over it on your own. But if we didn't have antibiotics, sometimes people might die. Their signs and symptoms can get so severe that you just get organ failure and things shut down, and death can be a result. So every pathogen has its own path, typically following these stages, and depending on the severity of the illness or the availability of treatments, there could be varying outcomes. And everybody's a little bit different. Some people have a lot stronger immune responses. Some people have weaker immune responses. Sometimes it's the immune response that causes you severe illness or even death, like you're overreacting to something. It's called a cytokine storm, and you get leaky vessels and drops in blood pressure and just total organ failure. So I know that's not a very fun thing to think about. Let's move on. Okay, so you're in your convalescence. You are maybe able to pass this pathogen on to somebody else. Isn't that the thing to do? No, we don't really want to do that. But just like our portals of entry, how the bacteria or virus got into us are very similar to how the bacteria or virus can leave our bodies and potentially infect somebody else. So we have secretions, tears, snot, saliva, sputum, milk, vaginal secretions, urine, semen, feces, skin flakes, blood, and earwax. Basically anything that can come off of your body or out of your body, depending on the pathogen's kind of prime location of where it is, you can spread and share that infectious disease. And again, we're just talking about infectious diseases, not things like diabetes or something. Clearly that's not a contagious disease or infectious disease. All right, so that was our discussion of disease. So what are the signs and symptoms? How can the viruses and bacteria actually cause disease and make us ill with those virulence factors, and the stages of disease? And then now that it's progressed through our system, how might it leave our body to potentially infect somebody else? All right, I will see you next time with our next topic. I gotta look at my notes. Modes of transmission. So we're getting into the epidemiology and following all these pathogens of once they leave the body, how can they get into somebody else's body? All right, so I'll see you next time. Bye.